Welcome to the Village of Hope. Village of Hope exists to save lives and to serve humanity through childcare, education, and healthcare. Since 1996, Village of Hope has been caring for orphan, abandoned, and destitute children. For 24 years, Village of Hope has been providing a shelter and a safe environment for trafficked children who have been rescued from traffickers. The hospital provides healthcare to over 80,000 people in 40 communities spread over 3 districts in southern Ghana. In these terrible times of COVID-19, the hospital has been the only facility that has provided life-saving medical care for these people in these rural communities. And the most vulnerable of these people are the children.
Upon talking with friends, Hope Christian Village Hospital was recommended for me. When I got here, the doctors helped me in all ways that they can to save the baby. But the NICU here was not ready for that because the equipment were not set. And they recommended that I rather go and have my baby elsewhere. So many things go on when you are moving from here to another place, and the place was very far.
When my wife was going to give birth to the second set of twins, she was in labor for 2 days. I was called and I was told my wife has kicked the bucket, and eventually I lost the kakra because of lack of some equipment. I've spent my whole life in this community. Me going down somewhere else to seek for healthcare, it has been a very difficult issue for me. There were enough equipment in this hospital. I believe my wife would have been safe.
On our 3rd day postnatal, when we came, my baby was yellowish, so they diagnosed him as a neonatal jaundice. So the baby was placed on phototherapy. We couldn't get it easy because there are a lot of babies there. There is only one phototherapy machine, so we have to join a queue for a baby to be discharged before my baby can be put on phototherapy. Even though my baby was safe, if the hospital is having more equipment, it will make the work of the doctors and the nurses easy to save more lives and to do more for the community.
I came to this town in January 2002, and I started coming to this hospital in May 2008. They realized I've developed a cardio problem. Most of the times in the evenings, when I get an attack, they put me on oxygen. I stay overnight. It's only one. Most of the time, somebody else will be rushing. So we have to share the oxygen periodically. They take care of us, and I've been able to live as long as I can. So please help us. Help us at FETE.
In Ghana here, almost 29 out of 1,000 babies who are born newly die every year. This in the rural areas is even higher. Around this district, the hospital serves as a de facto hospital, and that makes us have to take care of cases that usually would have gone to the teaching hospitals. Realizing the need for neonatal care, we have included neonatal intensive care unit as one of our latest departments. And so far we have completed a building. We have the human resource to take care of them, but sometimes we are stretched as far as equipment use is concerned. We recently liaised with the social welfare to bring in a young girl who we call Akosua Hope. When we found her, she was wrapped in palm fronds, and unfortunately for her, she had some of the thorns piercing her and scratching and cutting, making deep lacerations in the chest. Thankfully, by the care of the health staff here, we were able to take care of her, and now she is growing beautifully, and we thank God for her life.
The Time to Care project is an initiative I thought about because as a musician, to use my music for charity and humanitarian purposes. And when it happened that the COVID-19 pandemic spread around the world, the people that are in need and so on, how can we support them? So I decided to write a song that I will call Time to Care in collaboration with their music teacher, have the children to participate in the execution of the music in the studio. I was able to contact a very good friend of mine, Tamara Raven, who is a great musician, to sing the song Time to Care, using the music to raise awareness and to support this hospital. The proceeds from the music will go direct to the Village of Hope.
Donating to the Village of Hope and helping the pediatric care unit will save lives and help many infant orphans. Hard work has been done by Village of Hope building such a wonderful establishment, and your money will go directly to helping the orphans, and I hope you will all be inspired to donate something to continue this great dream. I can't say enough about the work Village of Hope has done and the humility and hope they have given many people.
A Time to Care is a wonderful project that will give life to those babies and children who are dying. Constant Boti and his friends and other institutions from all around the world seeks to give hope in these hopeless times. Through A Time to Care, we can make a difference in the lives of thousands of children that truly need help.